Hello. So I'm going to be performing my assessment on my imaginary patient again because I don't have anybody home with me. So if you just bear with me. So I would walk into the patient's room and I would introduce myself. Hi, my name is Eileen, and I'm going to be performing a focused physical assessment on you today. And this will include peripheral pulses and assessment of your head, neck, skin, hair, and nails. And I would let them know that I'm going to involve inspection, palpation, and then I would be listening with my stethoscope, okay? And please let me know if you feel any type of discomfort. I would perform hand hygiene, washing my hands, and then I would then identify the patient. Could I please see your wristband? I would check it. Mr. John Smith, that's great. Can you please tell me your name and your date of birth? He would repeat it back to me. Perfect. Sounds great. I would make sure that I would ensure privacy, so I would make sure the curtain is closed, and I would place the patient in a supine position with his head elevated to make sure that he was comfortable. Next, I would do the temporal pulses. So I would just place my fingers there and make sure that I can feel a pulse. If the pulse is 2 plus, that's where we want it to be, regular, bilaterally, and equal. The next one would be the carotid. I would check about right here, and I would check one at a time to make sure that I could feel it. The rate should be about 70 to 80 beats per minute. There should be regular rhythm, 2 plus strength, and equal bilaterally. Next, I would check for the brachial pulse, which would, be here. And I would feel there for until I could feel the pulse. It should be about 2 plus bilaterally. Next would be the ulnar, right here. Oh wait, radial. So it would be right in here. Same thing, I'm looking for 2 plus regularly, bilateral. And then femoral pulse, I would actually ask the patient if it's okay or only if it's necessary to check for the femoral pulse, but it would be right in the groin area. I would just palpate in there. It also should be about 2 plus in strength and symmetry bilaterally. Lastly, behind the knee, that's what popliteal pulse. I would check behind there again, 2 plus bilaterally. Posterior tibial is like in the inside, behind the foot, the bottom part of the foot. There. And then lastly, the dorsal would be on the top of the foot. It should be a 2 plus, equally as well. Then next I would inspect the head. I would check and feel to see if there was any tenderness or any masses, something that was out of the normal. And then I would check the neck, just make sure that it's symmetrical. The trachea is right here midline. Next, I would auscultate with the stethoscope right here, the carotids, to see if I make sure there's no bruits. And then abnormal findings would be something that's enlarged, hard nodules, or tracheal deviation. You know, if it's like off to the side, we definitely know there's a problem. Then I would inspect his skin to make sure that it's warm, dry, and intact. There's no open wounds, no scabs, no scarring. I definitely want to make sure to make note of that if there is. If it's appropriate color for ethnicity, I would check for skin trigger, make sure that it's elastic and no lesions. And then hair, make sure that it's evenly distributed. The scalp is clean and there's no like lesions on the scalp. I would inspect the nails to make sure that they're pink. Nail beds are pink and the cap refill is less than 2 seconds. And no clubbing, which I do not have any clubbing. Abnormal signs would be things like cyanosis, delayed refill, clubbing, lesions, and poor skin turgor would probably show some type of dehydration. And I would make sure to maintain privacy, make sure that the curtain was pulled the entire time. And at the end, I would thank the patient, thank you for your time, and I would let them know that the assessment is complete.